Would you know what to do if your dog choked right now? And if he cut his paw deeply or ingested something toxic? The difference between knowing and not knowing can determine whether your best friend will survive an emergency. In this video, we're going to show you exactly how to save your dog's life in critical situations and avoid the panic that can cost precious time. You'll learn 8 fundamental first aid steps that every responsible pet owner needs to master. Before we begin, please leave your name and the city where you're watching our content in the comments. Emergencies with our dogs happen when we least expect them. Veterinary studies show that domestic accidents represent more than 60% of emergency visits to veterinary clinics. Choking, cuts, accidental poisoning, and falls are more common than we imagine. The reality is that many pet owners feel completely lost when their animal needs immediate help. Panic takes over, precious minutes are lost, and often the lack of basic knowledge can make the situation even worse. We're going to explain how you can prepare to be your best friend's first responder. Step 1. Build your first aid kit. Having the right materials at home can make all the difference between a controlled emergency and a tragedy. We're going to tell you which items are truly indispensable in your canine first aid kit. First, you need sterile gauze and bandages of different sizes. Gauze serves to clean wounds without leaving lint, while bandages help control bleeding and protect cuts. Have at least 3 rolls of each available size. Blunt-tipped scissors are essential for cutting bandages and removing hair around wounds without further injuring your dog. Never use regular scissors with points, as in stressful situations you might end up injuring the animal. A digital thermometer is essential for monitoring body temperature. Very high or low temperatures indicate serious problems that need immediate veterinary attention. Also include an antiseptic specific for veterinary use. Products like iodine or diluted chlorhexidine are safe for wound cleaning. Avoid regular alcohol, which can cause more pain and irritation. Where to store this kit is as important as having the items. Choose an easily accessible location that everyone in the family knows. A transparent plastic box in the kitchen or laundry room works well. Avoid places that are too high or locked, as in emergencies you need quick access. Step 2. Know how to identify choking and act fast. Choking is one of the most frightening emergencies and also one of the most common. We're going to explain how to recognize the signs and act immediately to save your dog. The signs of choking are very specific. You'll notice intense and constant coughing, as if the dog were trying to expel something from its throat. Breathing becomes difficult, and panting, often accompanied by strange sounds when trying to breathe. A maximum alert sign is a bluish or purple tongue. This indicates lack of oxygenation and means you have few minutes to act. The dog may also become agitated, scratching its own face or neck, trying to remove the object. If the object is visible in the mouth, try to remove it carefully using tweezers or your fingers. Be careful not to push the object further in. If you manage to remove something, check if there are remaining pieces in the mouth. Even if you manage to resolve the choking, take your dog to the veterinarian immediately. There may be internal injuries to the throat or lungs that are not visible, but need professional treatment. Step 3. Control cuts and bleeding immediately. Cuts and bleeding can happen during play, walks, or domestic accidents. Knowing how to control bleeding can prevent your dog from going into shock from blood loss. The first step is to stay calm and assess the severity of the cut. Small bleeding that stops on its own in a few minutes only needs cleaning and protection. Heavy bleeding that doesn't stop or makes the dog weak are real emergencies. To clean the wound, use saline solution or clean water at room temperature. Never use very hot or cold water, as it can cause more pain. Wash the wound gently, removing visible dirt and debris. Use bandages to maintain pressure over the wound, but be careful not to tighten too much. You should be able to pass a finger between the bandage and the dog's skin. Bandages that are too tight can cut circulation and cause even bigger problems. If bleeding doesn't stop in 15 minutes with constant pressure, or if the cut is very deep, seek veterinary care immediately. Cuts that go through all the skin, expose muscles or bones, or are in locations like neck, chest, or abdomen always need professional suturing. Keep the dog calm and quiet throughout the entire process. Excessive movement can worsen bleeding and hinder healing. Step 4. Treat burns without aggravating the injury. Burns in dogs can happen from contact with hot surfaces, boiling liquids, chemical products, or even excessive sun exposure. Correct initial treatment can make the difference between quick healing and serious complications. The first rule is to cool the burned area as quickly as possible. Use cold running water, not ice cold, for at least 10 minutes. Ice water can cause thermal shock and worsen the injury. The goal is to lower skin temperature and stop the burning process. If the burn was caused by a chemical product, wash abundantly with water for at least 20 minutes. This helps dilute and remove the product from the skin. Use plenty of water and don't be afraid to thoroughly wet the entire affected area. Never apply ice directly over the burn. Ice can cause frostbite and further aggravate the injury. Similarly, avoid homemade ointments, oils, butter, or any oily product. These products can retain heat in the skin and worsen the burn. Burns that cover a large area of the body that are very deep or that affect the face, paws, or genitals always need urgent veterinary care. These cases can cause serious complications if not properly treated. Watch for signs of intense pain, like constant whimpering, refusal to move or eat. These can be signs that the burn is more serious than it appears. Step 5. React quickly to poisonings. Poisonings are one of the most dangerous emergencies and unfortunately very common. We're going to explore how to quickly identify intoxication and which first aid measures can save your dog's life. First, you need to know the main sources of poisoning at home. Plants like azalea, lily, tulip, and some ferns are toxic to dogs. In the kitchen, chocolate, grapes, onion, garlic, and artificial sweeteners like xylitol can be fatal. Cleaning products, pesticides, human medications, and even some diet foods represent constant risks. Signs of poisoning vary according to the substance, but there are some universal symptoms. Sudden and repeated vomiting, diarrhea, excessive salivation, and difficulty breathing are warning signs. The dog may become lethargic, disoriented, or have seizures. Changes in gum color are also important. Very pale, yellowish, or bluish gums indicate serious circulation or oxygenation problems caused by intoxication. The most important rule in poisoning cases is never induce vomiting without veterinary guidance. Some substances cause even more damage when they come back up the esophagus. Corrosive products like bleach can burn the entire digestive tract if the dog vomits. If you know exactly what the dog ingested, take the package or write down the product name. This information is fundamental for the veterinarian to choose the correct treatment. Photograph the label if you can't take the package. Offering water can help dilute some toxins, but don't force the dog to drink if it's vomiting or unconscious. In cases of seizures, keep the dog in a safe place, away from stairs or furniture where it could get hurt. Call the veterinarian immediately, even before leaving home. They can guide specific measures for each type of intoxication while you head to the clinic. Step 6. Immobilize fractures and transport safely. Fractures can happen from falls, accidents, or mishaps during play. Knowing how to properly immobilize a fracture can prevent even more serious injuries during transport to the veterinarian. First, assess whether there's really suspicion of fracture. Signs include the paw in abnormal position, inability to put weight on the leg, significant swelling, or visible deformity of the limb. The dog may cry in pain when the area is touched or try to protect the injured limb. Never try to reposition bones or push parts that are out of place. This can cause injuries to nerves, blood vessels, or transform a simple fracture into an open fracture. To immobilize, use a small board, thick magazine, or any rigid material that's larger than the fractured area. Gently secure the limb to the support using bandages or cloth strips, but without tightening too much. If the fracture is open with visible bone, cover the wound with clean gauze before immobilizing. Don't try to clean or push the bone inside. Just protect against contamination and transport immediately. For rib or spine fractures, transport is even more delicate. Use a rigid surface like a board or door to move the dog. Several people should help transfer the animal, keeping the body aligned. During transport, keep the dog as quiet as possible. Speak with a calm voice and avoid sudden movements in the car. If possible, have someone in the back seat to monitor the dog during the trip. Covering the dog with a blanket can help keep it warm and reduce stress. Injured animals can easily go into shock, and warmth helps maintain stable vital functions. Step 7. Protect against hypothermia. Hypothermia in dogs can happen not only in extreme cold, but also in situations of shock, blood loss, or when the animal gets wet for a long time. We're going to tell you how to recognize and treat this dangerous condition. Signs include intense shivering, extreme lethargy, slow and weak breathing, and pale or bluish gums. The dog may seem confused, move slowly, or even lose consciousness in severe cases. To warm a dog with hypothermia, use heated blankets or direct body contact. Wrap the dog in dry towels and place it near a gentle heat source like a heater. Avoid excessive heat that can cause burns. Warm water bottles, not hot, can be placed in the dog's armpits and groin. These areas have large blood vessels that help warm the body more quickly. Always wrap the bottles in towels to avoid burns. If the dog is conscious, offer small amounts of warm water or unseasoned chicken broth. Warm liquids help heat the body from inside, but don't force if the animal doesn't want to drink. Monitor temperature constantly using a thermometer. Warming should be gradual, about 1 degree per hour. Very rapid warming can cause shock and be dangerous. Even if the dog seems to recover completely, take it to the veterinarian. Hypothermia can cause heart, kidney, or neurological problems that are not immediately visible. Preventing hypothermia is always better than treating it. On cold days, limit outdoor time, use clothing on small or hairless dogs, and always dry the dog well after baths or rain. Step 8. Stay calm in any emergency. This is perhaps the most important step of all. A calm and prepared pet owner can act with clarity and efficiency, while panic can lead to wrong decisions that worsen the situation. Dogs sense our energy and emotions. If you're panicking, your dog will become even more stressed and scared, making any first aid procedure difficult. Taking deep breaths and keeping your voice calm helps reassure the animal. Before any emergency happens, have a plan. Know where the nearest veterinary clinic is, have the phone number saved on your cell phone, and know alternative routes to get there quickly. Practice first aid procedures mentally. Visualize situations like choking or cuts and think about how you would react. This mental preparation makes all the difference when a real emergency happens. Keep the number of a 24-hour emergency veterinary clinic always at hand. Many emergencies happen outside business hours, weekends, or holidays when regular clinics are closed. During the emergency, focus on what needs to be done immediately. Don't worry about guilt or how the situation happened. Use all your energy to solve the current problem. Communicate clearly with other people who might help. If you need help holding the dog or driving to the veterinarian, give clear and specific instructions. Nervous people can interfere if they don't know exactly what to do. Always remember that first aid is temporary care. Even if you manage to resolve the initial situation, professional veterinary evaluation is essential to ensure there are no complications or internal injuries. No matter how well you perform first aid, it's only the first step to saving your dog's life. Professional evaluation by a veterinarian is always necessary after any emergency. Veterinarians have equipment and knowledge that go far beyond basic first aid. They can identify internal injuries, administer specific medications, make adequate sutures, and monitor vital signs precisely. Even if your dog seems fine after first aid, complications can appear hours or days later. Internal bleeding, infections, heart, or neurological problems are often not immediately visible. When calling the veterinarian, describe exactly what happened, which symptoms you observed, and which first aid has already been applied. This information helps the professional prepare and can speed up treatment. If the clinic is closed, look for a veterinary emergency service. Many cities have clinics that work 24 hours or veterinarians on call for emergencies. Remember that your dog depends completely on you to receive necessary care. Knowing basic first aid can make the difference between life and death in critical situations, but professional veterinary follow-up is always indispensable. Now you have the essential knowledge to be your best friend's first responder. Practice these techniques, keep your kit always ready, and most importantly, stay calm. Your dog counts on you to protect him in any situation. If this content was useful to you, share it with other pet owners who also need this vital information. A dog saved by adequate first aid is a life worth all the knowledge in the world.